I believe we are live, and my my people are not helping me today. So let me see where Alp is. So because I do have the screen here, Dr. Irgau, so I want to make sure that that's up, so then I don't have to look at other stuff. So, but we are live. So, good afternoon, everyone. This is American Surgery Center and CHRIAS Bariatric Friday, and I'm here with, my name is Kemal Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Isaias Irgau on the Bariatric Friday. Dr. Irgau, how are you doing?
Very well, Kemal. How are you? Good,
good. So I'm not going to ask the regular intro for today. We have the intermittent diet that we are going to discuss. So because there are some questions that may be coming up through the session, I do want to actually have enough time for those. So just so that I can introduce all of you at once from the provider's standpoint. So like everyone already knows. Now I have to probably tell everyone that, just as a reminder, although I have a surgical scrub on, I'm not a surgeon or a physician, and this is totally my choice. So by choice, I'm not a physician. Our team, though, we have wonderful surgeons on our team, and Dr. Irgau, as everyone already knows from these events, Dr. Gail Wynn, Dr. Mike Peters, Dr. Rahul Singh, Dr. George Ibrahim on the bariatric side, and our colorectal surgeon is Dr. Sachin Vaid, and we are working with the team of great surgeons to make this happen. And our dietitians are Fran, Amy, and Beth, who are specialized in our bariatric patient population, as well as they are also specialized in the patients with diabetes, and we do have those events with Amy's leadership there. So today, before we go to our topic, we do want to actually mention that this is the group that we are presenting for, is the most experienced surgical group in bariatric, not only in Delaware, but perhaps in the United States. More than 10,000 surgeries among 6 surgeons, and over 2,000 in the past 3 years. And we have our surgical home is our surgery center, American Surgery Center, and we turned that place into a boutique, almost like boutique-like surgery center for the bariatric patients. And we have done close to 350 bariatric cases in the last 12 months, just last 12 months, but we do about 40 cases a month. So now this comes with certain accreditations and certifications. MBSA QIP is something that we obtained, and Blue Distinction Center Plus is another one from Blue Cross, and Aetna Institute of Quality is the equivalent of the bariatric surgery excellence, bariatric excellence. So, and that's what we have today. Now, all of these sessions are available on YouTube channels. And I know that many of you are watching these. And when we do our case conferences, we are actually sharing these events with our, these links with our patients in the pipeline, so then they can actually benefit from having these discussions. Now, Dr. Irgau, you were in the hospital today, right? So
yep, just came back.
Yesterday was your office hours. We didn't have a lot of time to discuss what, well, at least you didn't know the topic until like a couple of minutes ago. So, but I think the nice thing about this one is because this is what we do all day long, every day. We can be anywhere, and then we can talk about in a meaningful way what our issues for bariatric patients may be, how we can address those, what different options they may go through. And today actually is our one of our discussions that we did at the end of last year was the intermittent diet, intermittent fasting. And both you and I, we are doing this And we wanted to actually look at it from the bariatric point of view for patients who are morbidly obese. How would they benefit from it? What you can tell us about this fasting, and is it the right thing for the patients? Just from all part of it, if you can kind of go through that for us.
Absolutely. Thank you, Kemal. Definitely a very important topic. And we've talked about this before. And then we ourselves decided also to engage in it. And we've been very happy with it. Essentially, the idea, and there are different things that one can do, obviously, to try to curtail calorie intake. But with intermittent fasting, really what the idea is that we take a break from taking calories, whether it's liquid calories or solid calories, whether it's food, whether it's drinks. We take a break consciously, right? We say, during this period of time, I am not going to eat. I'm just going to have water or another drink that doesn't have any calories. That's the idea, right? We take a break. That means also, by definition, we are restricting the time in which we allow ourselves to have calories to eat, okay? And this can be done in different ways, but let's talk about the concept first. There is a kind of increasing popularity to intermittent fasting, done in different ways. People may say, okay, I'm going to take my 24-hour day and I'm going to divide it into a period of fasting and a window of eating. Or they could say, I'm going to take my week and then divide it into days of fasting and then days in which I eat. These are different things that people have done, right? But the concept is more important to understand. And then which one to pick, which one uses, depends on the tolerance level, on the lifestyle, and other things, right? So let's take, for instance, the simple way of doing it, like the intermittent fasting that happens every day, okay? Well, Kemal, you and I know that all of us fast during a 24-hour period when we go to bed. We sleep, right? When we are asleep, we are unconscious, right? And during that period of time, the only thing that gets in and out of our body is air, right? We breathe in oxygen, we breathe out CO2. That's what we do, right? There is no eating, there is no calories when we are asleep. So we are already fasting. And the idea is, let's expand those hours in which we are naturally fasting to our waking hours as well. And the way to do this, the simplest way to do this, Kemal, is to stop eating a few hours before one goes to bed, and then not starting to eat until a few hours after one wakes up, right? So, for instance, if we want to take an example of somebody who usually goes to bed at 10 p.m., they could decide to stop eating at 8 p.m. They say after 8 p.m., it's, the kitchen is locked, the fridge is locked, they can have water, a lot of water, but nothing else. And then they go to bed. Well, when they're in bed, they're already naturally fasting. And then let's say that person wakes up at 6, 7 in the morning. Instead of delving quickly into breakfast or snacking or something, what they do is they can drink coffee, they can drink tea with no sugar, because we want to avoid calories, right? And then they may decide not to have anything to eat, let's say, until 10 a.m. Or if they are a little bit stronger, until 12 p.m. Let's see what happens if they stop eating, they don't eat until 12 p.m. That means, Kemal, they have been fasting from 8 p.m. the night before all the way until 12 noon of the day next day, which means that's a 16-hour span. Well, 24-hour is a day, right? If you take 16 hours off for fasting, it means your eating window now is restricted to 8 hours. Mm-hmm. Now, people will talk about merits or not of this, right? And there may be people who really insist we have to eat 3 times, we have to eat 4 times, and so forth. And this debate may continue. But why do I like this idea, Kemal? Because I believe one of the biggest problems we have in our society here is we eat mindlessly, right? We eat mindlessly. Yes, exactly. There is snack. Food is pervasive. There is food everywhere. You go to the bank, Kemal, and they have candies right on the counter for people to pick up.
They do.
So because it's so pervasive, if you decide to have this type of restriction in which you consciously give yourself time in which to eat or not, then you are going to be eating less. And that's what we want. That's exactly what we want. And then for most people who are busy during the day, this is actually reasonably, achievable, right? And in fact, when I ask many of my patients whether they are breakfast people, most people will tell you, you know what, I don't even eat in the morning. I wait until late. Wait, well, do it properly then. Don't take any calories. And from a physiologic point of view, why is this important? I think it's important because when we don't eat, it means our insulin level stays flat. It doesn't rise. And insulin, on top of being a hormone that regulates blood sugar, is actually an important hormone that regulates whether fat cells utilize fat for energy purpose, let it go for energy purpose or not, right? So the less rising insulin we have, we're more likely to burn fat for our energy needs, which means we're likely to lose weight as well. So I do like this concept, Kemal. I do like, and I advocate it on our patients as well.
Now, Dr. Irgau, so I think we can look into this from a couple different angles.
Yes.
Right? So one is people who have morbid obesity and others who don't have morbid obesity. So you and I, we don't have morbid obesity, and we don't have obesity. So I was kind of at the edge a little bit, but I'm back to normal again, my normal.
Yeah,
so,
we would be defined as being overweight. Come on, because our body mass index is a little bit higher than the normal, right? So we would be that range, which includes probably the vast majority of Americans.
Sure. And now, when we do this, I think what was kind of like, so let me try to kind of because I'm in healthcare, again, not as a physician, but from the business standpoint, although we do have enough clinical knowledge, but what I'm trying to say is that even though I'm in this every day, but forgetting what sleep does for us, because there was always this issue of people with the sleep issues, they would actually gain weight.
Yes.
And you know that I have my sleep problems. So, and not giving that break to the body that already is impacting, right? So from simple terms. So now, if I'm not able to sleep, at least I need to give this break to the body in a sense that it doesn't take anything for a while, so that it can actually just recoup what it needs to do properly. That's the understanding that I have.
Absolutely.
And that was kind of like an eye-opening for me to like just realize, okay, well, this is why people have to sleep. So, and if you're not able to sleep, you have to do intermittent diet, so then intermittent fasting, so that you give that break to the body. Now, there are so many different benefits of this, right? With like weight loss, actually, weight loss was the not initial goal of this fasting. It was more for aging. And that's what I understood this a little bit better, Dr. Irgau. So when you introduced me to this, you know how bad I am with the names. I can't remember the guy's name from England. So it will come back to me at some point. Now, he actually...
The BBC reporter, right? That talked about that? Yes,
so
yes.
What he was able to, but why he started was mainly for the aging. And the understanding of why we age is because our body is working either at the regular level, so then we are just aging regularly, or maybe it's working more than what it's supposed to. And then it's almost like the car with 250,000 miles versus 100,000 miles. So it may be the same age, but one of them is going to be cleaner, the other one is not. And then people eating too much versus eating with these types of breaks, that makes it, that reduces the aging. That's the main idea that they came up with, right?
Absolutely, absolutely. So, you know, we are all made up of cells, right? The units that make up our organs are called cells. And cells are fairly highly sophisticated units that have a lot of activity inside them, right? They are able to process energy, they are able to manufacture proteins, but they're also able to do some cleaning
Exactly.
processes, right? So because the proteins that are inside the cells themselves have a finite lifetime, right? They break, right? They age, right? Now, when will those cells have time to do this cleaning, right? When will they have time? If we are continuously eating and engaging our digestive tract into this activity, it has to recruit all other organs in our body to try to process this energy, to try to process all the chemistry of the foods, get new proteins manufactured. And in the meantime, old proteins are accumulating in our cells, right? Well, it turns out that when we are fasting and we give our digestive system a break, those cells revert to a house cleaning activity. They get rid of old proteins by utilizing them for energy. And the less old proteins you have in your cells, Kemal, the younger you stay. The more old proteins you have accumulating in your cells, the more likely for you to age, but also develop different problems like cancers, essentially, right? So clearly, they have done extremely elegant experiments in mice, Kemal, that have shown that mice that take less calories, right, by fasting longer, actually live 3-4 times longer than the mice that were fed normal diets. It's incredible. But also, we know by experience that in populations where people are lean, where there is no such great consumption, ongoing consumption of food, people tend to live longer as well, right? And it's very interesting. Yeah, the other very interesting thing that come out, people have discovered is that not by choice, but by necessity, our ancestors, going back, 50,000, 60,000 years ago, our ancestors were doing intermittent fasting. And the reason they did that is because there was no food for them to eat, right? And it's interesting. If they lived long enough beyond infectious disease, beyond trauma, beyond dangers like that, actually they were able to live a lot longer in their 90s and in even beyond that. So when they studied actually the DNA of people who lived in that time, sometimes these people would have zero evidence of the diseases that we have that are killing us, like cardiovascular disease and cancers and things like that, which means that clearly by not keeping your digestive tract continuously busy 24 hours 7, essentially, you actually gain years to your life and you are healthier as well. So I absolutely agree with you that the reason people look into this is because of the impact on longevity, but improvement in quality of life as well, because you do not have the vast majority of illnesses that are killing our society: cardiovascular disease, metabolic disease like diabetes, cancers, and heart disease, right? These are the vast majority of diseases old people have in our country, right?
So, Dr. Irgau, when they were doing the mice testing with the mice, other than the age and other stuff, what they also discovered is mice actually, the brain of mice works better when they are more hungry because you are desperate. So they are more creative. So, we have this perception of, oh, well, if I'm hungry, my brain doesn't work. That's just a bad perception. But in fact, if you're hungry, your brain works better. So now, before we go to the morbid obesity side of this, Dr. Irgau, there are a lot of celebrities who are doing this, and Jennifer Aniston. So like, she doesn't have to do any of these, right? So, but I mean, this person is 50 some years old, and so I don't know who the next. I don't know this guy, Chris Pratt. Okay, so.
It's very popular, very, very popular.
So you can tell I don't watch. This is one of the Kardashian. Well, she's trash, but anyway. So Molly Sims. Now we like this person. So these are the people who are doing it. But then there's also from the People's Magazine. I think there are more people who are doing it. Now, why these people have to do this is one interesting point that everyone has to kind of really think twice. Why we shouldn't be doing it? Why we should be doing it? Now, I understand Jennifer Aniston wants to look so hot at age 53, but this is a bariatric program. So how do we utilize the intermittent diet for our patients, and where do you advise them to do it, when, and what's that process is like?
So that's actually great. Essentially, when we talk to our patients about this, sometimes it goes against the grain of the normal teaching. Oh, you have to eat 3-4 times a day. You have to keep on eating to lose weight. But clearly, some of our patients struggle even after bariatric surgery with some weight gain, or with wanting to lose more weight but having difficulty with it, right? I actually think intermittent fasting is perfect for bariatric patients. And here's the reason, Kemal. If you restrict your eating time to a certain window during the day, for instance, if we go back to the example I gave you earlier on, you stop eating at 8 p.m. and you don't start eating until 12 noon, it means you can eat only from 12 noon until 8 p.m. But because you already have bariatric surgery, you cannot overeat during that period of time. And that's the key here. Our patients may struggle after weight loss surgery a few years later, not because they are eating big meals, it's because they are constantly snacking, right? You're sitting on your desk working, and your desk has stuff. You go to the kitchen of the office and there is stuff in there. You go see a friend and there is food there. So you're not eating a lot at one time, but you're eating continuously. It's almost like grazing. We talk about how dangerous
the
grazing
physical
is.
therapy group, they bring pretzel in the morning to the provider.
Absolutely. Grazing. And our society is set up perfectly for grazing right now because food is pervasive, right? There is food everywhere. Well, you can break that by putting timetables for when you eat and when you don't, right? And then for our patients, as I said, they're not going to overeat during that little window because their stomach is small already. So this works really, really well for patients who are post-bariatric surgery and they want to lose a little bit more than where they are, but also if they're struggling to see some weight gain. Remember, our basic teaching to our patients when we first meet them, Kemal, is that bariatric surgery is a very powerful method for losing weight, but it's not a magic answer, right? A sleeve is a powerful tool, but it's not a magic answer. So the mindset has to be there for a person to utilize it well for them to stay thin for the rest of their life, right? So when I see them struggling 2-3 years later, I tell them, look, this is one way for you to regain control so that you're not mindlessly having, struggles again with the weight. So that's where I find it fits perfectly, in our patients as well. So it's a great point that you bring up this, stars that are doing this, even though they're not overweight, and how that relates to our bariatric patients. Well, it relates very well in a sense that I just explained.
It does. I think, what I like, one of my goals for our patient population is to make them understand that they are not the victim of anything, because everyone is going through these struggles.
Yeah.
And in order to get to certain, in order to maintain certain level, we make sacrifices.
Absolutely.
So,
Absolutely.
when I realized that I was gaining weight, last year, at the end of last year, it started until March. 2 of my best friends were visiting me, and I was thinking that everyone got heavier, and they didn't. And one of them was actually lost weight, and I'm like, oh my God, I just let it go because I wasn't walking. So since then, I walk 4 or 5 miles every day. So now, although it's simple, people still sometimes makes things more complicated. So just so that people can easily follow, this idea is about 16-hour break from the eating. When you add this with the sleep time, then you are easily able to get to that. So for example, if you go to bed at 11, so then 11 next day, and then 3 p.m., right, you can start eating. So
Absolutely.
3 p.m. So it's 11 p.m. So you are sleeping until in the morning, and it's not as bad. And there are days that I feel a little bit hungrier than the rest. Then I stop at 4 p.m. instead of 7 p.m.
Absolutely.
If you have a full-time job, it's a lot easier to do this Monday through Friday. So that's what we do. And on the weekends, I don't do it.
Right.
But even on the weekend, what I do is I skip the early breakfast as much as possible. So then I start afternoon. So then that still gives me some break. So I do see the benefit of it. So personally, I do.
And then don't you find, Kamal, sometimes even when you're hungry during the day, if you just drink water, actually it goes away sometimes. And the reason is, absolutely. And the reason is, I think, Kamal, is very often we think we're hungry, but we're actually thirsty. And if you think about it, because water shortage is so much of a problem, for our body from a short-term point of view than food, really, we may be confused sometimes. We feel we're hungry, but no, really we're thirsty because, we haven't been drinking. And that's the other issue also in our society, is that we don't have as good relationship with water as we should, right? As beings, we were made to drink water. Water is the most natural of the drinks that nature had given us, right? And yet I meet many people who tell me, oh, I don't drink much water. I've never been used to drinking water. What do you drink? Well, other pre-prepared, synthesized drinks, right? Come on. No, water really is the most natural thing. So if we didn't have this habit, we have to go back to this habit and learn to drink, learn to give this gift to our body as frequently as it needs it. And we may be even less hungry if we do that.
Absolutely. And someone is trying to come into my meeting. I don't know, but I think it's a mistake. So, all right. Now, Dr. Gal, this was great.
Yep, absolutely.
And, now we are going to go back to our first session as of next week. I'll talk to you actually later on. We may have a break or a couple weeks break before we start this all over again.
Yeah.
But we'll discuss that. And for now, we are planning to have our sessions next Friday. So thank you for being with us, and we'll see you soon. Bye-bye.
Thank you. Thanks, Kemal.